Good afternoon, everyone, and a warm welcome to our IGCP Live Doctors podcast. I am your host, Adafshin, and today we have with us a very special guest, Dr. Rajesh Chandra Mishra, one of the leading experts in infectious disease who has been closely observing and researching the evolving pattern of malaria in India and globally. So, Dr. Mishra, it's an absolute honor to have you with us today. Thank you for joining. And it's a pleasure to be here with IGCP and share insights on such important topic. Before we dive into our Q&A session podcast, Dr. Mishra, I would request you to please give us a brief overview of the current malaria scenario in India and how things has changed in recent years and what are the biggest challenges we are facing right now, sir.
So thank you, Ada, for this invite, and thank you, audience. Good evening, everybody. Uh, what we have seen in couple of years that we do not see very sick patient of malaria in ICU. Initially, the malaria was very critical. We used to get a lot of complicated, and then time came where early recognition of malaria, people started getting treatment early and appropriate treatment, and that has changed the critical stage of malaria. Post COVID, probably malaria is changing its pattern. The Plasmodium vivax or Plasmodium, which used to be very. And there are two kind of malaria. One is simple malaria, which we used to recognize in technical word. One is complicated. The vivax used to be very simple malaria, and falciparum used to be difficult malaria. But there are other strains of malaria which is coming from the particularly the Central East Asia to India because people are traveling a lot. So what we have seen in last couple of years that undiagnosed fever with malaria is coming, which is because of change in strain. Sometimes it's difficult to diagnose by rapid diagnostic test, but rapid diagnostic it's difficult to diagnose by rapid diagnostic test, and uh, we are not getting critical patient, but we are getting at GP level those patients which are difficult to diagnose just simple by rapid diagnostic change because of the change in strain. So again, the importance of old tests like QBC is becoming more. So if we are over relying on rapid diagnostic, we may miss some of the malaria. Strain is changed, and definitely Vivex is coming up more fulminant, which is not responding to the usual medicine, and for that you also need to treat them. In fact, treat them more aggressively than falciparum malaria because that has got different medical stage. One is in blood, one is the liver. So this is a change in pattern. So challenges are early recognition, changing strain, and the vivex, which used to be simple malaria, has become critical or complicated malaria. Ada.
Yeah, okay, thank you, doctor. That really sets the stage for our discussion. So let's now begin with our question, which we received from our audience, sir. So, starting with the global perspective, then coming down to the clinical. So, the question first is Dr. Mishra, is the rise in malaria cases globally a true resurgence, or does it indicate a failure of sustained public health strategies?
Uh, it's both because uh, uh, we cannot have any strategy which is absolute. It will always be relative, and since it has involvement of human and vector, uh, no strategy can be absolute which can control malaria because it's a mosquito-borne disease. Mosquito changes its pattern, changes its biting pattern, and as I said that malaria is changing its strain, though the species remains same, but it's changing its behavior, and other new species are also coming up, which is like not easy to diagnose. So it's a global resurgence as well as change in pattern. And since we have seen some success in controlling malaria, so government has also reduced its budget or spending on controlling of the vector or public, what do you say, spending on public to control the malaria as far as mosquito is concerned, or mosquito, because now there was a time when we used to see that a lot of insecticides being sprayed all over. Now it's not being done because government is not spending that money, and government thought that totally under control. Weather is changing. There is to be fixed pattern of monsoon. That monsoon is changing. So whenever there will be rain, there will be mosquito. So weather is changing. Malaria is changing. Is a strain. Government is reducing its expenditure, and behavior of mosquito, which is a vector, is changing. So all four things are going to contribute to resurgence of malaria. One more problem that we never have a vaccine for malaria. So that's another problem that we are not able to prevent the disease. As I said, that rapid diagnostic test was good, but of late, we have started recognizing that rapid diagnostic might not be good for every strain. So there may be some change in strain which might be missing from the rapid diagnostic test. And that's the reason for early diagnosis, we should combine both the rapid diagnostic test as well as smear examination, which we call QBC. So we should not miss any strain. So current strategy will always remain early diagnosis. If we miss that, then there's a complication. And apart from artesunate, even vivax, even falciparum, and other oval, all these species, most of the species has developed some resistance and other to most of the uh, anti-malarial, including there are resistance coming to artesunate. So there are some cases which is reported that falciparum malaria has become resistant to artesunate. So that's another challenge. So this is not one fold challenge, challenge at multiple level, and this is causing resurgence.
Okay. Thank you so much, sir. I hope you did justice with the question. So the first next question we received: in the post-COVID era, we often see overlapping symptoms. So what are the clinical red flag signs doctor must not miss in febrile patients where malaria mimics dengue or sepsis or viral fever?
Okay, so we are tropical country, and malaria, dengue, leptospira, scrub typhus, chikungunya, and viral infection, they come into category of tropical disease. Whenever any patient comes to us a fever, which is a high grade fever with some sign of the skin involvement, joint involvement, upper respiratory tract involvement, or generalized body ache, particularly when it's a monsoon season, we keep a tropical fever syndrome as a differential diagnosis. And there are certain tests which we do, and out of that, most sensitive remains platelet count. So it may be possible that if you are just looking for one value and patient comes to us within 24 hours, we may miss the critical patient and we don't follow up. So most of the time, when somebody comes to you with high grade fever, if you investigate initially and using antipyretic, don't let them go, or don't let them go like without further investigation. Ask them to repeat, because it may be possible that initial first 24 or 48 hours you may miss the antibody based test report, because antibody takes time to develop. Either you demonstrate the species, like if you are doing for dengue, you do dengue PCR. If you are doing for malaria, you do the rapid diagnostic test in form of QBC. If you are looking for the leptospira, it may take some time. So initial 24, 48 or 72 hours, it may be possible. If you are doing antigen or antibody based test, they may be negative until unless you are identifying the species itself by direct examination or indirect examination. So whenever you have this kind of patient, the safest approach is control the fever, monitor the vital sign, that is heart rate, blood pressure, oxygen, and sensorium level. That's a crucial thing, and respiratory rate. Ask the patient to monitor this. Do the basic test of CBC and according to your area, like malaria for QBC and rapid test, dengue test for dengue PCR. If they are negative, continue with antipyretic. Repeat, monitor the patient at home for the vital sign like heart rate, blood pressure, respiratory rate. If you can monitor, maybe in hospital, maybe in at home, and repeat those tests, at least CBC, to see what is happening. And if your platelet drops in next 24 hours, even by 20-25%, That means you are dealing with something significant tropical disease. If you are not finding any cause, better to admit that patient in hospital and repeat all the tests under observation rather than missing an important diagnosis. This is very common mistakes happen, that particularly when patient comes early, we do diagnostic test and every test remains normal because they take time to develop antigen antibody which our test can pick. So safest approach is do the basic test, follow the, just one sign you have to, just simple thing, follow the platelet trend. If platelet remains same, CBC remains same, it's a purely viral. But if your platelet start going down, hemoglobin going up or hemoglobin start going down, total count start fluctuating after 24 hours the test, that indicates you are dealing with some of the tropical disease, not a pure viral disease. Pure viral, most of things will remain normal, only your CRP will go up. But if it is any other tropical disease, there will be some fluctuation in hemoglobin level, some fluctuation in count level, drop in platelet count. So all these indicate that, or there will be some constitution symptom like skin involvement, joint involvement, eyes involvement, mucosal involvement. All these indicate that patient has got tropical disease. So some clinical sign, keen observation where you are missing the diagnosis and follow up after 24 hours saves most of the patient. What mistake commonly is done, we have a habit of seeing the patient report okay, writing antibiotic, antipyretic, asking them okay, come after 72 hours, and that's where you miss the train. You don't do any test in between. Patient feels okay, I'm taking the medicine like doctor has given. We have to change that mindset. If to just simply give antibiotic, after 24 hours ask the patient to come back, at least you just repeat CBC and CRP. It will give you a lot of information. And then if you're not satisfied with the report, ask the patient to get admitted rather than missing the train, that when after 72 hours, when 2 cycle of fever happen, hemoglobin drops, platelet drops, patient start developing organ dysfunction, then you admit, then you have delayed the diagnosis. So diagnosis delay is not our fault, since we do not follow the pattern, disease pattern, and we miss some time that what we are testing and how they become positive, and that's how we miss the diagnosis, and that's where problem happens.
Okay,
Okay,
thank you
Ada?
so much, sir. Yeah, thank you so much, sir. I hope you did justice with the question. So the next question is: has
That
climate
audience,
change?
that can audience can tell that I'm doing justice or not.
Yeah, yeah, sir. Of course you will. So
Yeah,
the
tell
next
me, go
question
ahead
is:
please, go ahead.
has climate change altered the clinical epidemiology and seasonal presentation pattern of malaria in India?
Yes, it has, because as I told you initially in my talk,
Hmm.
that
Yes, sir.
climate is changing, pollution level is changing. Rainy
Yeah.
season, in cold weather now you are having rain. Now, when there is summer, you are having rain. In rain season, you are feeling hot. So this change in weather pattern, changing weather pattern, is affecting the breeding pattern of mosquito. And ultimately, malaria is disease of mosquito breeding. Whenever there will be water, mosquito will breed. Whenever there is a water logging, mosquito will breed. Whenever mosquito will breed, they are going to feed on your blood. They are going to feed on blood. They are going to give you disease. This cycle is going. So every time your weather change, weather pattern changes, malaria mosquito breeding pattern will change, and mosquito breeding pattern will have direct correlation with all these tropical disease, particularly malaria, dengue, and chikungunya. They will fluctuate according to mosquito, according to your weather.
Okay, thank you so much for the answer, sir. So the next question is: how reliable is our current diagnostic ecosystem, especially RDT, PCR, and smear test for today's changing malaria profile, sir?
They're fairly reliable if we know how to use them. So if you are doing simple smear test, definitely it has got very low sensitivity. In smear test, you have to especially ask the special test called QBC, which has sensitivity and specificity of around 90 to 95%. The rapid diagnostic test, again, they are based on the antigen antibody detection test. They have sensitivity depending upon species around 90 to 95%. So I always say that if you want to be 100% sure that patient has malaria or not malaria or change his species, you do both the tests, QBC and as well as rapid. What I have seen over time, people have stopped doing the QBC test. They totally rely on rapid diagnostic test. And if you totally rely on rapid diagnostic test, there is a chance that if there are other species apart from Vivax, falciparum ovale, and malaria, you will miss them. And in these species also there is chance that if the antigenicity has changed, you may miss around 10% of the malaria case. So my suggestion is always that if you combine both QBC and particularly if you are in endemic area, rapid diagnostic, there is chance that 100% you will be able to pick up the malaria diagnosis.
Okay. Thank you so much for the answer, sir. So the next question is, does India need a new malaria vaccine strategy, sir? Like before the disease burden explodes?
So look, we do not have any vaccine for malaria. So there is no question of new. In fact, we need to find a vaccine. There are two diseases against which we definitely need vaccine. One is the dengue, and another is malaria. But as I said, that both of them are difficult because it has not got a single species, a single strain. It's a multiple strain and multiple species disease, and that's why it is very difficult to make vaccines. People have. I'm not saying impossible, but at least since last 100 years, we have been trying to develop a vaccine against malaria and dengue, and we failed because of the changing species and changing strain. So we do not have any vaccine against malaria. We definitely need them, but as I said, that we are not even putting fund to control the vector, which is at least known key factor to control the disease. Finding a vaccine is a huge investment. Who is going to do? Bill and Melinda Gates Foundation is investing hugely to find the vaccine against dengue and malaria. They have some success, but still not has been very successful in finding a correct vaccine against dengue and malaria. But we have a hope because they are very near to it. We have a hope that we may find a vaccine against malaria and dengue very soon because they have invested huge amount of money to control this disease.
Okay. Thank you so much for the answer, sir. So the next question is, many patients are treated in OPDs. Do you think we are over relying on RDTs for decision making in such cases, sir?
Yes, too much. In fact, there was a time when people used to give empirical antimalarial for all fever patients. Then they started giving. It became a standard that any fever should be treated with antimalarial, and that's how the resistance has developed. Now, rapid diagnostic test has come that tells us yeah, it is good when it tells you that this kind of species patient has is good to treat. If it is Vivax, you treat appropriately. If falciparum, you treat appropriately. But relying absolutely on rapid diagnostic test in early phase, you may miss around 10% of the malaria cases, and that has to be kept in mind. That when you are missing and patient has persistent fever, platelet count is dropping, and you are not able to find the cause, relook with both the test QBC plus rapid diagnostic test.
Okay, thank you so much for the answer, sir. So the next question is, are we ready for what experts call hybrid vector epidemiology with mosquitoes showing behavioral shift like day biting adaptation, sir?
I'm not getting this question. Little longer question. Can you just reread it?
Yeah, sure. So the question is, are we ready for what experts call hybrid vector epidemiology with mosquitoes showing behavior shifts like day biting adaptation?
So, what I understood from you that mosquito is changing its behavior from night to
Yeah,
day shift,
yeah,
and
sir.
that is causing. That's why I told you initially that vector is changing. The mosquito is changing its habit. Now, there was a time then this Anopheles mosquito will bite only in night time when you are sleeping. It will not bite in daytime, but that no longer remain correct. If it is in surrounding, if it says that, it can bite you anytime. So As far as we are ready, we don't know, but we need to understand this, that mosquito has changed its behavior. If they are hungry, they can bite you anytime. If you are protecting yourself in daytime, they will look for the night time, they will look for the food in daytime. So what we have to understand that that uh, uh, sorry, somebody unnecessary. What we have to understand is that uh, if mosquito is changing its behavior, we have to protect ourselves in daytime as well as night time. So same protection strategy applies in endemic or pandemic area, which you apply in night time. That keep your windows closed, wear full sleeve cloth when you are in that going in endemic area. You need to take prophylaxis. So all this behavior has to be managed. But yes, that is correct. That mosquito is changing its behavior, and that's why
Okay.
resurgence chance is increasing. That we are kind of reluctant. Okay, nothing happens in daytime, mosquito will come and bite only in night time, but that may not be correct.
Okay. Thank you so much for the answer, sir. So the next question is, how do you see the future of malaria elimination in India? Are we moving in the right direction, sir?
Look, malaria elimination can only happen when you can eliminate the mosquito.
Yes, sir.
We as a tropical country is not possible to eliminate mosquito. What we can do, we can minimize the mosquito biting, we can minimize the mosquito breeding. So if we can control, if we can really improve our hygiene, if
Yeah.
we can improve our surrounding area, if we can work on improving hygiene, if we can avoid the water logging, it's the simplest thing, but most complex. If we can do at individual level and society can do at their level, then we can control the mosquito behavior and population, and then we can reduce malaria. If we are not able to control that, and if we think that we can eliminate just by singing a slogan or song, it is not going to happen. It really needs a ground level work to control the mosquito breeding space, and that can only happen when India become clean, when we can remove the all the water logging space. Simplest thing, then it can take
Yeah.
care.
Yes, sir. So thank you so much for the answer, sir. So the next question is, many still believe malaria is only a monsoon disease, sir. Why is this belief dangerous in today's scenario, sir?
Uh, Mosquito, because I said that it research during this time because mosquito
Okay.
breeding is increases. So the
Okay.
moment you have water, mosquito will breed. Otherwise, mosquito is lying dormant. It's not like they're dying. Their eggs are lying
Mm.
dormant. The moment there's a water, they get space, they get food, they get oxygen to breed, and then they multiply. And when mosquitoes multiply, is going to come in the contact of human being, and that's how it's going to disease.
Okay.
That's why
Thank you
breeding,
so much.
if you reduce the number of, yeah.
Okay. Thank you so much for the answer. So the next question is, what are the biggest mistakes people make? They self-treat fever assuming like it's just a viral fever or something.
So just one line answer, nobody should treat any fever with self-medication. You must consult a doctor,
Yes.
even a general practitioner. You can take one dose of
Mm.
paracetamol to treat fever, that's it. But you must do some basic investigation, and there is always a cause for fever. If you treat the cause, then you can avoid the problem. You can avoid antibiotic resistance. You can avoid the misdiagnosis. Otherwise, if you self-medicate, just control the temperature. Do not treat the cause. You are likely to going to bound to have complication and more death and problem. So you are risking your life at the cost of ignorance if you are not getting right kind of treatment and right diagnosis. So don't do that.
Okay. Thank you so much for this tip, sir. So the next question is, people often use home rapid tests, sir. Like, are these reliable enough or should one still go for lab confirmation, sir?
It is not 100% as I said, but it has got 85 to 90% reliability home test of the rapid diagnostic test. But as I said that If it is negative and you have fever, better to consult your doctor. Don't just rely that you have done test, there is nothing. If you continue to have fever after taking one dose of paracetamol, better to consult your physician to find the cause. Don't self medicate, don't self treat.
Okay.
Life is very
Thank you.
precious. Don't risk
Yeah,
your
sir.
life. Just, yeah, yeah.
Okay. Thank you so much, sir. So the next question is how safe and preventive medicines, like for people traveling to malaria endemic areas, sir?
They are very safe and reliable. Like people take mefloquine, or somebody take doxycycline, or some even people take paramethamine, sulfadoxine combination. It is recommended according to the only thing you need to know which area you are traveling and what is the prevalence or resistance. And particularly those people where malaria is not there, if they are traveling in endemic area or epidemic area, they must take malaria prophylaxis. And even after taking prophylaxis, there is a chance that you can have malaria. They should document, and after coming within 4 weeks, if you have developed fever, you must look for the cause of malaria as a cause fever as a cause of malaria. Otherwise, other way people died just coming from the endemic zone because they did not picked up in time, and it became fatal, and people develop multi-organ failure.
Okay. Thank you so much, sir. So the next question is why is early diagnosis even more important today than it was a decade ago?
So we have a definitive treatment. If you diagnose early, you can give definitive treatment. Second thing, there are many causes of fever, particularly tropical disease. If it is malaria, you give anti-malarial. If it is dengue, you don't give anything, just observe, give antibiotic. If it's a leptospira, you treat leptospira. If it's bacterial, you give antibiotic. So early appropriate diagnosis is key for right kind of treatment and early treatment. If you delay in treatment, each time malaria damage your RBC, you develop more chance of getting multi-organ failure, thrombocytopenia, brain injury, lung injury. So to avoid the development of multi-organ dysfunction, to avoid the complication, you need to diagnose early. To give right kind of treatment, you need to diagnose them early.
Okay, sir. As I can see, sir, there is only one question is left, sir. So the last and final question is finally, like doctor, for our audience watching today, so what simple daily lifestyle changes can help reduce mosquito bite risk without any extra cost, sir, in India?
Just avoid waterlogging in surrounding your area. Keep your surrounding clean. Try to wear, particularly in monsoon season, try to wear full sleeve clothing. Use mosquito repellent when you are going in area where there are mosquitoes. Simple thing, keep the mosquito repellent cream with you. And if you have traveled in mosquito borne area, and if you develop fever, keep a very high probability that you may have malaria, you may have dengue. Test them appropriately. Take appropriate rest. Don't self-medicate. Consult your doctor. Tell them that you have traveled in this area. This can be probability. So if you are proactive, even if you have malaria, it can be treated. But if you just ignore it, then it can become fatal.
Okay. Thank you so much, sir, for sharing your such valuable insights, sir. Like it's been an incredibly informative session. So, and to our viewers, we hope today's discussion helped you understand malaria from a more practical and preventive perspective. So, remember, awareness and timely action can save lives. So, with all your permission, sir, I'm going to conclude this podcast and stay tuned for more such live session brought to you by IGCP. And thank you everyone for joining. So, I am Adafshin signing off. Stay safe, stay aware, and take care. Thank you so much, sir.
Thank you. Thank you for this. Thank you. Take care. Bye.
Thank you so much, sir.